everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS, and let's just continue and move to the last lecture of the psychiatry section for the success course of the UKMLA 2 exam. Okay, today what we're going to discuss is something called the somatic disorder. Okay, in which a person believes that there is something wrong with them, but actually the patient is completely fine. Okay, and you're going to encounter a case like this when you're preparing for your PLAB 2. So the patient would be presenting with a mole either on the hand or on the neck, and by the look of it, you're going to maybe get an idea that okay, if there is a mole, it may be a derma station. Okay, but there is a very strong possibility that in the case notes, this particular line is mentioned that states that all the investigations and all the examination came out to be normal. Okay, so now if the patient is presenting and complaining that there is a mole on his hand or mole on his neck, then how come the examination and the investigations are completely normal? Okay, so this should ring a bell in your head that okay, there may be something mentally or psychologically wrong with the patient. Okay, and that is what the somatic disorder is. All right, you'll get a hint. Okay, if the GMC is very generous enough, they may give you this particular line to give you a hint, but but the GMC can can play with you. Okay, they can just give you this one single line that Adam Smith, 30-year-old, presented with a mole in the hand, and they're just going to remove this particular statement, and they're just going to say that go and talk to the patient and address his concerns. Okay, so you would enter into the session with the mindset that okay, this is a derma session and I need to take the derma history. Okay, and then that's how you'll begin. Not going to go in a detail of what the derma history is. We have discussed this thing in detail, but I'll just touch upon the headings that you're going to explore the mole or explore the lesion, okay, and its associated symptoms, and then you're going to ask about the red flags, okay, and rule out the possibility of a squamous cell or carcinoma or a basal cell carcinoma of the skin. Okay, and then when you ask for the picture, okay, that okay, now I would like to examine your mole, or I would like to have a look at your mole, then you would see that okay, there is absolutely no lesion present. Okay, and that is where you would realize that okay, there is no lesion present. Okay, this may be a case of the somatic disorder. All right, so just stay there, just stay calm. Okay, don't say anything that okay, there is no mole present, there is no lesion, why are you getting worried and xyz. Okay, because if you do that, the patient would become very over dramatic. Okay, and would start crying that doctors don't take me seriously, I'm not okay, there is something wrong with me, you're not helping me, and all of this thing. Okay, and if the patient starts to go into this particular state, and if the patient starts to get very emotionally overwhelmed during, like, in the middle of the station, okay, then the patient will not give you the time to do the data gathering and get the data that you want to take. Okay, so if you see that there is no lesion present at this stage, just stay silent. Okay, and just move on with your data gathering. Okay, and I'll tell you what to do and how would you uh, explain and how would you share this thing with the patient. Okay, but till here you just explore the red flags and then you just move on. So now if you don't see any lesion, this is the point where you will realize that okay, this can be a psychiatric issue. Okay, so immediately you want to ask about the psychiatric aspect, that how is your mood on a scale of 1 to 10. Do you ever feel the need to harm yourself? Okay, and very important, do you see or hear unusual things? Okay, because he may be just having some hallucination that okay, something is there on his neck or something is there on his hand. Okay, so you have to explore the psychiatric aspect immediately. Right after moving from the derma structure, there needs to be a shift to the psychiatric aspect. Okay, and like this is very very important because this is a pure psychiatric case. There is no organic cause, there is no dermatological cause. Okay, so do rule out the psychiatric aspect immediately after you realize that okay, this is not the typical demonstration that you have in the exam. Then you cover the other aspects of data gathering, like you do the floor, you do the peer data. Okay, I'm not going to go into the detail. I've talked about it a lot in the previous lectures. Okay, and then the meftosa. But one thing in the meftosa that I would definitely talk about right now is basically this anything else aspect. Okay, in the anything else aspect, what you need to do is that you need to identify the risk factors of psychiatric illness, that whether or not that the patient has recently lost his job, or recently lost someone dear to him, someone near to him, okay, or whether or not the patient is having any financial or emotional stresses, okay, that may have caused the patient to act like the way that he's acting right now. Okay, so you need to ask this particular aspect, and most likely you're going to find something like this, that this patient may have lost his father because of skin cancer, and this or maybe this patient must have lost someone very near, very close to him, because of some dermatological issue, and that's why he is thinking that he also has some issue similar to that. Okay, so you need to ask about the anything else aspect, that okay, why is the patient behaving the way that he is behaving. Okay, and that is all you need to do in the data gathering aspect. Now comes the difficult part. Okay, till here it's just nicely asking questions, getting answers, and the most of the answers would be no. If you're going to ask about any fever, no. Any weight loss, no. Any loss change in appetite, no. Any past medical illness, no. Any allergies, no. Any family history, you may get a positive family history about someone dying in the family because of a chronic illness, but it can be no as well. Okay, so any recent travel, no. Okay, how's your diet? Completely fine. Any alcohol, no. Any smoking, no. Okay, most of the answers would be no. Okay, so like this data gathering may seem very extensive right now, like it's so many questions, like so many layers, but it would hardly take any time, because most of the answers would be just no, 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 that you would be uh, getting. Okay, so do not get worried about the length of the questions. Okay, you would be very easily able to cover all of these questions very very quickly in your data gathering. Okay, now comes the difficult part. Okay, that is explaining that how you're going to explain it. Okay, so you're going to say that from the chat that we have had and from my examination findings, you might be having a condition. Okay, you can say that of your mind, in which you develop a false perception of your health. Okay, that can be triggered by emotional and psychosocial stresses. Okay, and you're going to explain that means that you may not be having a condition. Okay, you may not be having a problem. Okay, and you may just feel that okay, there is a problem, but the problem may not actually be there. And the moment you say that, okay, this melodrama that I have just mentioned on the screen, okay, that melodrama will pop up, and that no doctor, you don't take me seriously, no doctors take me seriously, you trust me, I'm not okay, there is something wrong with me, and no, I want to get tested, please do all my investigations again, please run all my tests again. Okay, and it may get difficult for you to manage the situation, but what you need to do is that you, number one, you need to be very supportive of the patient. Okay, you need to tell the patient that all right, I do understand that you're feeling this way, and like sometimes when you're going through a lot emotionally and mentally, it's completely okay to feel this way. Okay, and this is nothing abnormal. Okay, a lot of people do experience what you're experiencing right now, and I hear your concern. I do understand that you want to get yourself tested. What we can do is that we can repeat your investigations. Okay, we're going to make sure that we are going to examine you all over again. Okay, we may give you some medications as well, just to make sure that everything is all right with you, and trust me on this, you're going to be fine. Okay, and whatever you're saying, it may be true, and we may be missing out on something, and I'm not really saying that you're lying or something, but what I'm just trying to tell you is that you may be having some false perception. Okay, so you need to strike a balance. Okay, agree to him on a few things, just so that you sound supportive, but keep on reinforcing and keep on slowly slabbing this point in, that okay, they may be having a false perception. Okay, they may be having a false perception of their condition. Okay, and just be very supportive of them, that okay, no, trust me on this, we are taking you seriously. I know that you feel that you're not okay, but trust me on this, you're here with us right now, We are going to make sure that everything we do and everything that we say and everything that we manage in your case like helps you get better and helps you get over the condition that you are facing right now. Okay, so be very supportive. Okay, you would have to calm the patient down. Okay, in a very very nice and a very very diplomatic way. Okay, then I usually don't cover the management in the success course. I just cover the data gathering and the structure, but I believe that the management over here is important. Okay, so like there is absolutely no need to repeat the investigations. Okay, as all the results were normal. But you may just give the lollipop to the patient that okay, if we feel that okay something is not normal, we are going to repeat the investigations. Okay, so be very clear on this particular aspect. Then referrals are like important. Okay, you may need to refer the patient to different support groups, to psychologists. Okay, and admit if the criteria is there. Okay, what does that mean? That if the patient is having a low mood, if the patient is having a thought of harming themselves, okay, then you may need to admit the patient. Other than that, the only referral that you need to do is just to the psychologist for CBT and for talking therapies. Okay, um, then there is absolutely no need for any medication, just the reassurance. Okay, you need to constantly reassure the patient that okay, everything is going to be fine. There is absolutely no need for the medication. Okay, and just refer to the psychologist and say that okay, we're going to refer you to the psychologist, we're going to refer you for some talking therapies. And if they also believe that something may be wrong, they may refer you back to us, and then we are going to start you on the medication. Okay, so try to use the possibility of a possibility, that for example, if you have something, if someone also feels, if the psychiatrist also feels, or if the psychologist also feels, or if we feel that there is something wrong with you, we are definitely going to start you on the medications. Okay, so keep these things in mind. All right. Then in this patient, advices would be very very important about the friends and family support system. Okay, encourage the patient to do some lifestyle modification. Okay, and ask them to be active. Ask them to try to get their minds diverted. Okay, provide advices on good exercise, good diet. Okay, that would help him get out of it. Okay, and then safety netting on low mood and suicide. All right. One more very important thing that needs to be done is that you need to arrange regular follow-ups with the GP, because this will help the patient get reassured that okay, they will be in constant contact with the doctor. Okay, so what you can say is that I understand that you feel ill. Okay, again you're being supportive. Okay, I understand that you feel ill, so what we can do for you is that we can arrange the regular follow up with the GP. Okay, or we can put you on regular follow up with the GP just to make sure that everything is all right with your health. Okay, and that would be something that would be very very reassuring for a patient having psychiatric thoughts and psychiatric condition like this. Okay, so make sure that you are using this thing, and you're using this option in your management, that you're putting the patient on regular follow up. Okay, other than that, it's a pretty simple station. Okay, you just need to be highly reassured, and you need to just provide that patient the comfort and the support that the patient needs. Okay, so that's it. That's pretty much it from my side for the psychiatry station. If you have got any queries and any confusion regarding it, then please let me know. I'm going to address all your concerns. Drop them down in the comment box, or reach out to our social media to drop your questions and drop your queries. I would love to address all of them. And if you want a personalized mock, just scan the QR code for more details. See you in the next lecture.